ADHD and anxiety often co-occur, and it can be really hard to know the difference and know where one begins and the other one ends. ADHD is known for inattention and hyperactivity and impulsivity. While inattention can for sure lead to anxiety through mistakes and oversights, we're going to focus on hyperactivity and its relationship with anxiety. It's hard because the diagnostic criteria really doesn't get into what hyperactivity feels like. The diagnostic criteria, they're really built for children. It's easy to spot in children. They're fidgety, hard to sit still, they get hurt a lot, they get into trouble, they do impulsive things, they have outbursts. But by adolescence, that's not really acceptable socially, so we learn how to compensate for hyperactivity, and you can think of it as what happens is it's internalized hyperactivity. So anxiety and hyperactivity, they have similar sensations. Hot, restlessness, energized, increased heart rate, overwhelmed, racing thoughts. So for what adults may experience as anxiety, there are times when, and indeed it might be hyperactivity. And that's not always the case. But with ADHD, when I think I'm anxious, it might actually be hyperactivity. And that's a really important distinction. Because if I mistake my hyperactivity for anxiety, I may begin to look around and try to figure out, why am I anxious? And at any given time in our lives, there are so many things that we can be anxious about. So I might find something and then really kind of like hyper focus on it and obsess over it and really create a high degree of anxiety. If I'm experiencing hyperactivity and I'm able to identify it as hyperactivity, then I don't have to get lost so much in the anxious thoughts and kind of really lose myself in anxiety and make it difficult to function in life. So it's a really important distinction. Identifying hyperactivity as hyperactivity or anxiety as anxiety helps me, one, know what it is and determine effective courses of action. And there are times too when anxiety, it's a part of life, it's going to happen. So if I'm prone to hyperactivity and anxiety is present, my hyperactivity and anxiety, they can really build off one another and snowball and really turn into like an unpleasant internal situation where I'm very restless and feel very unpleasant and find it very difficult to function in life. So it's really important for us to be able to, at least to a degree, separate out the hyperactivity and anxiety. And that can be really hard to do for anybody, right? Even a clinician, it's difficult to do. We really have to kind of do good assessment and work with people to determine what's going on there and some testing and too. So it's important most times for individuals to work with a competent and skilled clinician to help them, one, differentiate and determine anxiety and hyperactivity, and find ways to help them tolerate it, feel more pleasant, less unpleasant, and engage life. So, it's strongly recommended that if you think this is the case, that, you seek some guidance through a competent professional for assessment and then what to do going forward.